An independent report found a county phone line is dropping 5 out of 6 calls, essentially hanging up on people 350,000 times a month. Joining me are Nick Macchione, Director of San Diego's Health and Human Services Agency, and Sandra McBrayer, who is with the Children's Initiative, a group that produces a yearly report card on the health and safety of children and families. It also tracks food stamp participation rates. Thank you both for being here.
Pleasure.
Nick, I want to begin with you and talk about this report. How long has this phone service been in use, and when did you first learn that it was hanging up on people?
Well, the Access Center, as we refer to it, is an ability for anyone to call into, without going in physically to a family resource center, to access information and to start the eligibility process for public assistance, be it not just for food stamps, which we call CalFresh, but Medi-Cal, Welfare to Work, or Medi-Cal in terms of health insurance. We have started this initiative for about the last 2 years, we embarked on, and we saw the need and hearing from the community the importance of being able to call in and not necessarily having to go to a physical site.
So for 2 years, has it been hanging up on people?
No, we started the project for about 2 years ago when we began the planning of what might it look like, what is Access Center. This is something no other county government has done.
But how long have you known that this has been a problem, where it's hanging up on people?
When we started the call center and people started calling in, now this is about a year into it, we realized that we were going to need some assistance experts. Again, we're not experts in call centers. And we hired a statewide expert called Intelligy that came in, did a full-fledged study. This also came as a result of one of the recommendations that one of our advisory boards did with community participation. And that started about February last year. We completed the study, and a number of recommendations were laid out, and we began to implement those recommendations.
One of them is hiring more people so they can answer this phone. Have you hired more people?
We are embarking on that process. In the fall, we began to add about 17 county employees. We're adding 50 more employees as a result of the recommendations of the study in Phase 1, and additional 50 employees in Phase 2.
Now, Sandra, your organization tracks food stamp use, so some of the numbers I'm going to run by you are familiar to you. Between 2006 and 2011, enrollment numbers have been up dramatically in terms of people receiving food stamps. 83,000 5 or 6 years ago, now 236,000. But, here's the big but, participation rate is still the lowest out of 22 large metropolitan areas studied by a national think tank. 40%. So in other words, 40% of the people eligible, according to this national think tank, are actually getting food stamps here in San Diego County. Why is it tougher to get food stamps in San Diego County than other large cities and counties?
I don't think it's actually tougher. When you need to look a little deeper in the numbers, I think for a lot of adults, they're not applying for food stamps. I talk to adults throughout the county who are saying, I'm trying on my own. When you look at the numbers and you dig deeper into the numbers, in San Diego County, and let me just use an example, there's about 136,000 kids who live in poverty at the federal rate. And of those, 127,000 currently have food stamps. So with families with kids, they're accessing food stamps. And so when we want more to, because obviously more kids in poverty as the economic crisis continues. But as you dig deeper, you're seeing that there are some people who are choosing not to, and others who are saying, you know, and like on the unemployment, they're saying, I'm still not eligible for food stamps.
I have to tell you, when I've been covering this issue for a long time, we've interviewed a number of people who've gone through this process, and these stories are not new to you. I know that, Nick, where people say that whether they're being hung up on, whether they're in a lineup for hours, whether it's the questions that they're asked or how they're being treated, I think when people at home hear you say they're choosing not to, there are going to be a lot of people who are very angry saying, no, it's the way that I'm treated when I try to.
It is a difficult process, and I think the county has taken incredible steps. They've heard over years that there is a difficult process. I mean, that's part of how Access started, where parents were saying, I can't afford to take off and find a babysitter and stand in line. So the county has implemented a whole lot of systems in place, from electronic signatures to video conferencing, trying to say to parents and families, how do we make it easier? That's part of what this study was about.
So I want to ask you, Nick, now when it comes to hiring more people, you know too that KPBS looked at budgets for the past several years for the County Board of Supervisors. What are they spending their money on? They have consistently reduced spending on health and human services, yet at the same same time increase spending in other areas, specifically public safety. Do you have the budget? Are you getting the money you need to hire the people so that people get this benefit?
Excellent question. I think, and we have unequivocally been reducing the budget. Unfortunately, it's not the Board of Supervisors. It's really the state of California and the state budget crisis that have pushed down on a lot of budgets.
Let's back up on that, okay? Because the federal government, the USDA, provides 100% of this benefit. The state and the federal government provide 85% of the admin costs. The county is only responsible for 15% of the admin cost. And as demand increases, we also know that the state, it doesn't increase the per applicant fee, but it gives you money every time you sign someone up. So how do we blame this on the state?
For the last 12 years, the state has given no increases for the administration of these programs.
Right, but they do increase when demand goes up. They haven't increased the per application fee that you receive.
Well, the struggle all counties have, I will tell you, and talking with my colleagues, is that the state of California does not give adequate resources for the administration. That said, to answer your question about are we adding funds to the positions, not only are we adding the funds for the positions with the resources we have, but we spent nearly about $4 million in developing the Access Center. This came about in 2009 when the Board of Supervisors approved the Nutrition Security Plan, and that's really what embarked on how do we make it easier? How do we work with all our partners and make it easier for the applicants to call in? So there has been a conscious investment in this program. I think that we do care about getting to families. I think the numbers indicate, as you pointed out, there are some families that are not choosing to apply, but it's not for the lack that they don't know about the program or if they don't want to go to a welfare office to call in.
Okay. I'm going to have to leave it there, but we want to make sure you come back after you've made these changes and tell us what the new numbers are. Nick Macchione, thank you so much.